Good evening, everyone. My name is Meredith Toohey, and I'm the Conferences and Events Manager at the American Nutrition Association, the ANA. The ANA would like to thank our sponsor, Standard Process, for their support in bringing this webinar to you. Visit their website, standardprocess.com, to learn more about their dedication to the field of nutrition and whole food philosophy. The American Nutrition Association is very pleased to be hosting Dr. Marisa Marciano tonight to explore the clinical use of herbs in treating inflammatory conditions, tissue regeneration, and detoxification. Welcome, Dr. Marciano.
Thanks everybody for joining me today. My name is Dr. Marisa Marciano. I'm a naturopathic doctor and a registered herbalist, and the topic for today's webinar is going to be taking an herbal approach to managing inflammation. So we're going to be covering a variety of different herbs today that might be potentially indicated in either acute or chronic inflammatory conditions, and just trying to be able to tease through what some of the differences around them might be. And my goal really is for everyone listening to this webinar today to hopefully leave feeling a little bit better equipped to apply some of these really powerful herbal medicines in their practice and as they relate to inflammation in our patients or our clients, which is obviously a huge number of people that could really benefit from the therapeutic application of herbal remedies a little bit more regularly. So just a little bit more about me before we get started, and just let me introduce myself. So I am based in Vancouver, British Columbia, in Canada, where I have a private clinical practice, and I'm also the chair of the Department of Botanical Medicine at the Boucher Institute of Naturopathic Medicine. So I teach and I oversee clinicians at the school there, so both a clinical and a faculty member. And I've also authored the Evidence-Informed Guide to Botanical Medicine, which was really meant as a herbal reference guide for my students, but also I think translates really well to different healthcare practitioners as just a quick resource, a guide that you can, it's not a huge textbook. It's fairly concise, and I think, all of the most relevant information that clinicians and students need about, we have almost 200 herbs in this book. So that's something that I hope is useful perhaps to you. And a lot of this information within the book can also be found on my website, which is thenaturopathicherbalist.com. So I'm primarily a clinician and an educator, and in my private practice, I primarily am using herbal medicines as well as plant medicine and nutrition, along with different kind of lifestyle modifications and such. So that really is, herbs and plants are really the backbone, I would say, of my clinical practice. And why do I use herbs? So, I think we're seeing this resurgence of people kind of coming back to herbal medicine. This is obviously one of the oldest forms of medicine that we have used as mankind on the planet. We understand that these are very medicinally concentrated substances. And so, we learn lots of different modalities in naturopathic medical school. Herbal medicine really resonated with me the most because I really loved nutrition, and I understood that plants contain medicinal properties. And so the more plants I could get to know that could have these therapeutic properties, the better. And this is me at a workshop. I'm teaching how to make a cedar-infused salve. So I really love also just being hands-on with plants, being immersed in nature, and kind of getting my patients and my students really interested in tapping into the power of plant medicine in a variety of forms. So medicine obviously doesn't always come from a bottle. It can come from just being outside in nature, recognizing that medicines are all around us, and also from our food, obviously, on a daily basis. And so, and the other thing about plant medicines is if you understand the benefits of, obviously, food as medicine, it's very easy to understand that herbs can be viewed in this way, that they contain various macro, micronutrients, and phytonutrients. And so we think about the foods that we eat in large quantities, they're mostly going to be contain macro and micronutrients, which are obviously very essential to life and to our well-being. Whereas what we consider medicinal herbs, perhaps, are going to be plants that don't have as high quantities of the macro and micronutrients as the foods that we consume in larger amounts, but will be much more densely concentrated in what we call the phytonutrients, or in herbal terms, we'll often refer to as plant constituents. And really, these are secondary metabolites. These are substances, compounds that are naturally occurring in plants that they're making kind of for their own purposes that were, I think, once really thought to be almost waste products by these plants. But we now recognize that when that within our bodies, they can have really profound therapeutic effects and be used alongside macro and micronutrients as essential nutrients for life to promote health and treat and prevent disease. And so these would include, for example, things such as the volatile oils, tannins, flavonoids, alkaloids, kind of the list goes on. And we'll be exploring a few of these secondary metabolites today that we find in plants that we understand are really key to helping resolve and modulate inflammation in our bodies. And I have a picture here of schizandra berries because I think berries in general are such a great example of a plant that is so rich in phytonutrients, but also we can consume in large amounts for its macro and micronutrient contents. So, there's this great overlap between medicinal foods and herbal medicine that we can start to see unfold as we learn more about many of the plants in the materia medica. Just building off of the idea that plants and plant medicine is more than just what's inside a bottle. In school and in our medical training, it was very much focused on, the pharmacology and the mechanism of action of these various plants. But I really found, and once I was out in the world and in my clinical practice, that this idea of being able to connect people to the plants would usually lead to greater outcomes. And I think the Biophilia Hypothesis is a great theory that really demonstrates this, and this is something that started coming up within the literature in about the 1970s or so, where researchers were starting to investigate, why are humans so interested in nature? And we always have had this kind of natural affiliation to nature and to the plant world. And it really is, I think, a reflection of how we are from an evolutionary standpoint, very similar in our biological makeup. And we've evolved alongside plants, and plants are really like our kin to a certain degree. So fostering that type of connection, I found, can be really beneficial. And maybe some of you have heard of nature deficit disorder is like a thing we're seeing, especially in our younger generations. But if we can connect back to that natural kinship that we have with plants, I think that you do end up seeing greater outcomes when you are using plants in your patients. So just something to keep in mind. This is doing a herb walk, a photo here of connecting with the plant medicines. This is another picture of a very common weed, maybe some of you know in the bottom there, that's plantain, which is, we throw pesticides all over, but is actually a really powerful herbal medicine that grows all around us. So recognizing these things, again, I think really valuable before we get into some of the nitty-gritty pharmacology bits. Thinking big picture, this is also a really important part of herbal practice. And so what I've just demonstrated here is a beautiful field of lavender. As an example of this, just can you imagine how you'd feel standing in this field, and imagine if you could smell it, that plants can be therapeutic and be medicinal far beyond just their chemical constituents and just beyond their biological activities within our body. They really do offer us so much more benefit to our lives. So I love that photo. And then when it comes to prescribing herbs, actually giving herbs, we do need to consider, some key things. And we will go through this today by using a case example and kind of working through the thought process when it comes to applying these herbs to a person in your practice. So, of course, do no harm. We need to make sure that we're using herbs safely. We want to make sure we're meeting the needs of the individual patient and taking into consideration their capabilities, their preferences, their ability to really stick with treatments or even afford some of the remedies. So and of course their own health habits and individual pharmacokinetics will all potentially change how I might give a herb, or what herb I might give and in what form. Our goal is, of course, to improve the overall health and vitality of the body. And herbs are so good at doing this, as opposed to just, treating individual symptoms. And we're really not trying to mask symptoms in our patients. We want to neutralize causes of disease and control symptoms if they're being really troubling. And of course, in inflammation, pain is sometimes a big part of that. And we want to make sure that we can manage that as much as possible. But really, our goal is to nourish the overall body, all of the different systems, and we'll talk more about this today, organs and systems that are making sure that they're functioning at their best, so that we get actual resolution of the chief complaint. So inflammation is a great topic to just demonstrate this with, I think. And as I said, we'll go through a case as an example. And we also, taking into consideration the herbs that we choose, we want to make sure that we're choosing herbs consciously and sustainably, because there are some ecological concerns we want to be aware of. Some herbs are at threat of over-harvesting, so we might want to choose alternatives when certain herbs are at risk. And as well, not just necessarily jumping to whatever's the most popular herb at the moment, the really hot herb of the moment, which happens, and herbs can become quite trendy. But instead, really looking at our scope a little bit more broadly, and ensuring that we're really choosing the best options and not doing anything superfluously. So the topic of today being inflammation, I think, it's very important just to understand what inflammation is. And so, of course, this is a natural, healthy, normal bodily response to injury, and it involves a very complex cascade of immune signaling and inflammatory cytokines, as well as immune cell activity. It's a necessary stage of healing, which I think is really important, just as we go through this, to remember that we shouldn't want to suppress inflammation, because that suppression can also often lead to kind of uncontrolled or unresolved or chronic inflammation, which, as we know, can lead to all types of chronic disease. When we're dealing with acute inflammation, we're dealing with heat and redness and swelling and pain and loss of function. And usually this stage doesn't last too long, but we do want to control this stage if possible without entirely suppressing it. We really want to focus more so on how do we resolve inflammation, especially in those chronic inflammatory cases. And I think that's where most of us as practitioners and clinicians are meeting patients. We're coming up on them. They're presenting in our clinic in office, I should say, as managing chronic concerns. So that's really where I think our focus will be with the use of herbs. And I would say really where they shine, because herbs are not like drugs. They're not, just, shotgun approaches to a specific symptom. They're much more of they're taking the approaches and foods would, having a kind of nourishing long-term benefit. And just looking quickly at, the resolution of inflammation, that there's lots of literature now where we're understanding more so about how healing occurs, and that inflammation is again, a very necessary step in repairing and regenerating tissue, and it's an active process which really shouldn't be inhibited through suppression. And there's different ways at different stages of wound healing. I've just highlighted here a couple types of herbal actions that might be indicated at different stages of the wound healing process to help support the pro resolution pathways, and not necessarily, again, suppress it. And we'll be focusing on the anti-inflammatory component today. So some of you might know what this herb is pictured here. I'm going to ask you guys a little just thought-provoking question, which of the following herbs would you consider to be an anti-inflammatory? Chamomile, turmeric, boswellia, hops, hawthorn, green tea, milk thistle, all of the above, or none of the above. So if you guessed that this herb on the left was turmeric, you'd be right. This is that brightly pigmented, yellow pigmented root or rhizome that most people are very familiar with as an anti-inflammatory plant. So absolutely, we could consider that to be one. So this is me being a little bit cheeky in terms of when we use the language of an anti-inflammatory herb. Yes, all of the herbs on this list would be considered anti-inflammatories, having anti-inflammatory properties. However, one thing I hope is a big takeaway for you today and kind of challenge your thinking around is that really no herbs are anti-inflammatory. That when we use that term anti-inflammatory, what we're really referring to is something that completely inhibits the inflammatory process. So we're thinking about medications, for example, that will shut off the inflammatory cascade in its entirety. And herbs don't do that. Herbs don't have that kind of single pharmacological approach. As we'll see, they're complex combinations of chemicals, the naturally occurring chemicals that will, again, always have this kind of modulating effect upon the inflammatory process. So kind of the answer is all of the above and none of the above here. And I will be continuing to use the term anti-inflammatory throughout the rest of this webinar in regards to herbal herbs. But I think it's important to keep in mind that really we should be thinking about herbs more as modulators or mediators of inflammation. So inflammatory modulators versus anti-inflammatories. And again, that's because they're complex mixtures of phytochemicals that have numerous pharmacological effects in the body that are capable of targeting multiple cellular signals and pathways and gene expression that can mediate immune cell activity. And really importantly, can, as they're doing this, simultaneously nourish and repair damaged tissues in the body and help remove metabolic waste. And all of that will help contribute towards the restoration of tissue function after inflammation, especially acute inflammation, has been resolved. And so this is a recent study, 2018 study that I thought was great, that just explored some of the comparisons between anti-inflammatory drugs and looked at herbs for countering inflammation. And just pulling out one quote here that I liked, that the authors said that modulation of the physiological process, that herbs are able to modulate, the physiological processes in a way to suit a normal balance between inflammation and anti-inflammatory mediators, like maintaining a balance between pro-inflammatory and anti-inflammatory cytokines or antioxidants, and oxidants or immune stimulants and immunosuppressants. So again, we see this often with herbs, that they never really necessarily push the body towards doing any one thing. They're helping support and resolve inflammation or oxidative stress or immune activity to help bring the body back to health in a way that is very different from an anti-inflammatory medication. So anti-inflammatory herbs, then we see that list of herbs and we're okay, so they're all anti-inflammatory. What makes them different? Well, some key things, these herbs will vary in regards to how they've been used traditionally. And sometimes, many of these herbs have been used for thousands of years, and over that time have been observed to have maybe specific organ system affinity or body tissue affinity. So a very common example of this for, people will use is hawthorn, and hawthorn having this organ affinity towards the heart. And we do see that, that's something that's been observed over time, and other herbs that is the case for as well have maybe a specific affinity to an area of the body. It's very hard to explain why that is, but it's just been a traditional use, something that folk herbalists have observed and we kind of carry forward. The herbs were also going to vary in their constituent profile. And so what are the compounds, the secondary metabolites that they're making? What do we know about their activity? And also importantly, their bioavailability within the body. It's one thing to understand that a herb contains a certain compound. It's different thing to understand, is that compound, where is it able to actually travel within our bodies? Is it going to stay in the gut? Can it get into the bloodstream? Can it get into the brain? Those types of things also are very different for each of these herbs. There's going to be a huge range of quality and availability of clinical evidence for herbal medicine. So some herbs like turmeric. There's a plethora of studies that have been done mostly on curcumin versus the whole plant, which we'll talk about a little bit today too. But then there's other herbs like cleavers, for example, is a herb that I love and use in my practice quite often that has almost no clinical evidence behind it. It's almost entirely traditional use. So depending on where you land as a practitioner, you're going to have kind of your own opinions and your own style and approach to using herbs. Some practitioners, they need that randomized control trial at that specific dose in order to feel confident to use the herb. And others maybe are more flexible and are combining the two. That is sort of where I land as a practitioner. The herbs are also going to have, depending on the form of medicine that you give, and the dose obviously might vary. Some herbs we can take far more of. So turmeric is, again, an example of this. Because it's sort of like a food, we can consume pretty large amounts of it, while other herbs, we have sort of a more narrow therapeutic window, so our dosing strategy will change. And then, of course, every herb is going to have its own profile of potential adverse effects, your toxicity concerns, and drug interactions. So coming back to safety, and herbs are in general quite safe, but there are always times where we need to be cautious, and we want to. I tend in my practice to err more on the side of conservatism when it comes to safety. And so doing our due diligence before we prescribe or recommend anything, that and being aware that allergic reactions and kind of paradoxical reactions and things can occur with herbal medicine, even though they're usually fairly benign and self-limiting, that's something that we need to be on watch for as practitioners as well. So we're going to be looking also at each of these herbs today, not necessarily as, I don't want you to leave thinking, I'll give this herb for this and this herb for this, like taking that symptomatic approach, but more so understanding that systems-based approach. So seeing how the herbs really respond or work within a body system. And when we are confronted with an inflammatory condition, especially a chronic inflammatory condition, recognizing what body systems are in need of the most nourishment, and then choosing our herbs based on their action upon those body systems, as opposed to their symptoms. Very briefly, I think it's important to acknowledge the traditional approach to inflammation was very much around plant energetics, which is something that we can understand on a certain level. I think it makes sense to a lot of people that a herb such as cayenne would be a heating or warming herb, whereas comparatively to something like lemon balm or even peppermint or hops is more cooling and calming herbs. And so those heating herbs, we see ginger on that list, mustard and garlic, and turmeric as well. When treating acute inflammation, usually those herbs would be reserved. So we wouldn't want to kind of throw more flames on a fire, and if that's the analogy works for you. We might want to start with, slightly more cooling herbs that don't suppress the inflammatory process, but kind of control it to a certain degree. So this is just, I think, interesting to think about from an energetics perspective, and recognizing that depending on the stage of inflammation that you're dealing with, maybe if this approach feels good for you, you might choose certain herbs over others as well. So this kind of ties into traditional use and folk use of various herbs. But I think is useful, I've seen come up personally in clinic, we think that turmeric should just treat every case of inflammation across the board equally. And sometimes turmeric doesn't give me the results that I'm expecting. And I think that sometimes that can have to do with the individual constitution of the person being a little bit already too hot, or in a more of like a yang state. If you're a TCM practitioner, then that might not be the best choice. So just, I think another side to considering our herbs as medicine is thinking about these energetic and traditional uses. And most of this is drawn from a variety of medical philosophies, which these were all at certain times, very sophisticated systems that were used to assess and diagnose and treat the patient. So we have, 5-element theory in traditional Chinese medicine, and Ayurvedic theory, with tridoshic theory, First Nations, and humoral medical theories. These, were around for thousands of years, and really our current medical model is we've left a lot of this behind. But when we see that mankind for thousands of years has been viewing the body and health as this kind of balance of energetic forces within the body, and that herbs would, in all of these practices, be employed to help balance out those kind of forces. I think it's worth exploring. And again, if some of you are already kind of using some of these models in your practices, then I think it will make maybe more sense for you as a practitioner who uses herbs to apply them in these types of ways. So, of course, turmeric has already came up a few times. You can't possibly give a talk about inflammation without talking about turmeric. Turmeric's Latin name is Curcuma longa, and it is the rhizome of the plant that is used for medicine. It's been used traditionally in Ayurvedic medicine, probably as its first application, for thousands of years. And what I have pictured here is actually in the bottom right-hand corner, a turmeric-infused honey that I have made. And just powdered turmeric mixed into honey is one of my favorite ways to employ this herb as food. It tastes really delicious, and I think it's really important, if we can, whenever we're using herbal medicines, is to taste our medicine. I think our body gets a lot through the senses, and that can be important as well. Outside of just being an anti-inflammatory, what I've listed here are just some, and not a complete list, but a list of some of the other actions that turmeric is known to have within the body. So again, coming back to this concept of herbs never just doing one specific thing, that they do many things, and acknowledging that we can actually have overlapping therapeutic effects from any given plant. It's, in the example of turmeric here, it might have anti-inflammatory activity for sure, but it's also quite good at lowering cholesterol, and it actually also will help stimulate bile release from the gallbladder. It also has carminative effects, so it can be quite calming towards the digestive system. So, like I say, not a complete list, but an example, I hope, of the various actions and mechanisms that are at play in any one given plant. And this is a list of all of the various constituents or chemical compounds or secondary metabolites that are found within plants, along with its macro and micronutrient content. So you'll see, almost 70% of turmeric is carbohydrate. But the constituent that gets talked about the most, obviously, when it comes to turmeric is curcumin. And curcumin is actually, there's several types of curcumin. The curcumin 1, that first structure you see at the top there on the left hand of the slide, makes up the predominant amount of curcuminoids within this plant, which are really interesting molecules that aren't really found in any other plant and are very heavily researched for their antioxidant and anti-inflammatory properties. And while curcumin is extremely important, I highlight here the essential or the volatile oils that are found in this plant. I think are also incredibly significant. The turmerones especially, I think, are a very interesting compound. And what we're learning and kind of seeing start to come out through some of the research around this plant is that the combination, the synergistic effects of these compounds seems to be ideal for the overall therapeutic activity of turmeric. And if you're into whole plant eating, then it makes sense to sort of also take up a whole plant approach to herbal medicine. We don't just want to pull out the vitamin C from the apple. We want the fiber and the moisture and the other various, the carbohydrates and the other vitamins and minerals found within that food to all be a part of what we're consuming. Nature's kind of packaged these things together. So it's very much the same from plant medicine. I hope that's something that gets taken away from this lecture, that turmeric is a lot more than curcumin. It's a lot more than just trying to get as much curcumin into our body as possible. Even though curcumin and the pharmacology of curcumin has been by far the most perhaps heavily studied of any plant compound for its ability to reduce inflammation. And it does this through a variety of different mechanisms. it obviously is working on the inhibition of pro-inflammatory responses, key ones being nuclear factor kappa beta, and also inhibiting the expression of various cyclooxygenases involved in, and I should just say overall, cytokines involved in the inflammatory cascade and in immune cell activation. Again, though, there is an inhibition of the expression of the inflammatory response here, but it is not a complete suppression by any means. And coming back to this idea of bioavailability, I think it's a good example. Curcumin is a lipophilic compound, and it can actually enter into the bloodstream and cross the blood-brain barrier, which is quite unique. Definitely not the case for all of our herbs and the compounds that we find within them. There is a lot of direct activity within the gut, and the gut microbiome, as we'll see with many of our plants, is becoming more, we're understanding more and more just how important fermentation within the gut, and in some cases hydrolysis of certain plant constituents is required in order for the compounds to become actually bioavailable within our bodies. And so to see that curcumin is a compound that can in this way become bioavailable to the bloodstream, be circulated around the body, and actually enter the brain is quite interesting. And there's been many types of products and ways that I'm sure you've heard about, even traditionally, to how we can enhance sort of the uptake of curcumin, because it's not an incredibly bioavailable substance. As I said, most of it stays within the gut, but how can we increase its ability to circulate and kind of be giving it to other body tissues? One sort of interesting way is by forming a complex with galactomanosides from fenugreek fiber, which I think is pretty interesting. You're able to, in this way, curcumin it almost acts as a bit of a Trojan horse, and curcumin is able to bypass some of the enzymatic degradation through the liver that it would normally go through, and in that way get through the hepatic first pass hepatic circulation and enter the bloodstream more readily. Other common ways that I'm sure many of you have heard of in terms of increasing curcumin bioavailability would be things like black pepper, or combining it with a lipophilic substance of some kind, so phosphatidylcholine or lecithin. And what I've highlighted here, just very quickly, some of, I think, the best research around the indications that have been supported by clinical trials for both curcumin and curcuma longa, but just remembering that it is quite different, and most of the research has been done with curcumin versus the whole plant, curcuma longa, because it's much easier to do research on a single compound than it is a whole plant, and understand what it's doing really in the body. So all this talk about curcumin is, we're focusing on one compound, but I think it's important to remember that anti-inflammatory herbal constituents, or these compounds, there's many, and many outside of curcumin that maybe we just haven't explored sufficiently, or there is incredibly convincing studies that have been done to show the power of some of these compounds, such as the salicylates, key flavonoids. We see essential oils and various terpenes, saponins, resin, mucilage, and essential fatty acids all being found within plants, usually many of these constituents at one time being found within a single plant, and all having this ability to modulate inflammation. And this is a quote just taken from a study really highlighting this biochemical nature of these plant constituents matching themselves to our own physiological molecules, perhaps better than synthetic ones, and therefore having more bioactivity. And what I think is also very important, not just that they are able to produce these desirable effects within our body, but also have less, or in many cases, no adverse effects that we would commonly see perhaps with medications that are derived from some of these compounds for their anti-inflammatory properties. And so I think a very good example of this is with willow bark. Willow bark, obviously, or Salix alba, contains salicylates, a group of compounds called salicylates, particularly salicin. which we know many people are aware is the basis for the anti-inflammatory medication aspirin. And so acetyl salicylic acid is a plant-derived pharmaceutical that has analgesic effects, antipyretic effects, anti-inflammatory effects, and blood thinning or antiplatelet effects. Unfortunately, it also has some adverse effects on the GI tract, especially, and can be quite erosive to the lining of the GI tract, and in some cases even cause GI hemorrhage. So, that's, I think, an example of finding, one of these anti-inflammatory constituents and recognizing that when it's not given as the whole plant, then we end up, it might be incredibly fast acting and effective, but we end up with some maybe not as desirable effects as well. So when we use the whole plant, the whole of the willow bark or willow bark extract, we are actually consuming primarily salicin, which gets hydrolyzed by our gut bacteria into salicylic acid, which is sort of the most potent of the anti-inflammatory salicylates. And we can still have some of those anti-inflammatory and analgesic properties, of course, present from the plant in that way. St. John's wort, I highlight here, maybe it's not a herb that jumps to people's mind as an anti-inflammatory, but the flavonoids in St. John's wort, there is some incredible research around and almost on par with the abilities of constituents like curcumin, Hypericum perforatum is sometimes referred to as like herbal sunshine. It's a plant that is probably most well known for its action or its ability to aid in mood disorders, specifically depression. And it gets compared a lot to the use of various SSRI antidepressants due to a similar but by no means identical mechanism of action of SSRI antidepressants. There is, however, a hugely important, when dealing with mood disorders and depression, neuroinflammation is something we're understanding becoming, more of a part of that symptom, that clinical presentation. You might have heard of something called the inflamed brain, for example. So the approach to inflammation to depression being far more than just serotonin production, but actually helping control inflammation within the brain and within the nervous system as a whole. And that's really where St. John's wort shines. Another powerful anti-inflammatory is licorice or Glycyrrhiza glabra. And here's an example, multiple anti-inflammatory constituents found within licorice, lots of flavonoids, lots of mucilage. Saponins are probably the most recognized or pharmacologically studied, specifically glycyrrhizin, which is found within licorice. And essentially glycyrrhizin is converted again by our gut flora, cleaved by gut flora, into, excuse me. Sorry about that. I'll start that again. So licorice, its saponin content has, once converted by gut flora, cleaved by gut flora within our digestive systems, has the ability to have these kind of direct effects, mineralocorticoid, sorry. Oh, give me 1 second. I'm going to start that again, Meredith. Sorry about that.
Of course, no problem.
Okay. So licorice, another fantastic herb that we would consider as a demulcent anti-inflammatory, contains saponins such as glycyrrhizin that are cleaved by our gut flora into other plant compounds that will then have these kind of direct effects upon mineralocorticoid receptors within our body. Those are largely responsible for what people are sometimes aware of with licorice having an ability to increase blood pressure, and this is due to a kind of a pseudohypoaldosteronism. So essentially acting a little bit like aldosterone, it can bind to these receptor sites and cause sodium retention and potassium excretion and water retention as well. But what it also does is inhibit some key enzymes involved in cortisol metabolism. And specifically, overall, licorice can have this cortisol sparing activity. And cortisol is obviously a hormone that is responsible for many effects within our body, but one of the big ones is controlling inflammation. So, something probably closest herbal we have to something acting like a synthetic corticosteroid, like say prednisone or hydrocortisone, licorice would be a herb that I would go to in those types of cases. Boswellia, which is also known as frankincense. Maybe most of you are aware of that, but that's always, for some people in the audience, the first time they put together that Boswellia, serrata, and frankincense are the same plant. It's a resinous exudate from this tree/shrub that has been used, again, traditionally in Ayurveda and really has fascinating historical and mythological uses behind it. The resin itself contains boswellic acids that have been studied for their ability to specifically inhibit LOX5 enzymes. But interestingly, we're learning now there's other compounds. It's not all about those boswellic acids, which we often will see products standardized to. Insensyl acetate, which is another terpene found within this plant, is now being recognized as quite responsible for its effects on nuclear kappa effector beta. So again, we want that, as much of that whole plant as possible. And we do seem to just be uncovering more and more about it, never being about one particular compound in these plants. But Boswellia has very similar research behind it. It is in good clinical research that would be similar to turmeric, specifically in treating inflammatory conditions such as like osteoarthritis, reducing pain and inflammation over time. So, I think just highlighting a couple of these herbs, my hope is that you can see that there is a chemical synergy that exists within plants that, we get this, we call it plant synergy. It's more than a sum of their individual parts. And this exists within a single plant and its individual constituent profile. And then once we start combining herbs together, we can also tap into plant synergy because we get two herbs and all of these incredibly powerful compounds coming together and interacting. And it's sometimes quite hard to know for sure what will happen in these cases. There are a few small cases where there might be antagonistic effects, but the majority of time there's going to be synergistic effects. And this was just an example of a study that I found demonstrating the ability of curcumin and boswellic acid combined together to have an overall greater effect than when each was given individually. And this was in a study of osteoarthritis. And what the authors presumed was that they thought that the boswellic acid was actually able to decrease the expression of glucuronidase, which would then reduce the glucuronidation of curcumin. And of course, that can lead to less bioavailability of curcumin. So you're essentially inhibiting that enzymatic process so that there's overall more curcumin available to be circulating around the body. So that was, again, just an example of putting two herbs together for potentially having a greater overall effect. So I hope this kind of breaks down the myth of the panacea plant, which I like to, really break people out of just always jumping to turmeric or always jumping to hawthorn or whatever it might be, and kind of expanding out to other horizons with herbal medicines, recognizing that pretty much every herbal medicine will have inflammatory modulating properties. It's just that certain ones might be more indicated in certain cases. And look at how we can maybe combine some of them together to get this kind of overall additive therapeutic effect. And if you're feeling overwhelmed, like, oh my gosh, all of these plants, how am I going to learn all of them? Just know it's a lifetime of learning for sure. The learning never ends in herbal medicine. But I do hope that you have access yourselves to a good, high quality herbal monograph source, and there are some great books out there, or I encourage all my students to be building their own herbal monographs. And what I've listed here are just some of the key things that you would want to have present in a herbal monograph, which is just a place that you're organizing all of the information, kind of the most pertinent information that you need to know about a plant to access it, be able to access it quickly, and the more you become comfortable with a small selection of herbs and a good quality herbal monograph around that herb, the easier this information will be coming to you down the line. So, very quickly, I want to take us through a case example. And I chose this case of interstitial cystitis because I thought it was a good exemplification of a chronic inflammatory condition that does have an acute component. So it can become, interstitial cystitis is this sort of long-standing, potentially autoimmune reaction where the lining of the bladder becomes quite inflamed and irritated, but can also cause really acutely uncomfortable symptoms. So this was a case of a 30-year-old female. Her symptoms were frequent and urgent urination with some spasm and burning midstream. The symptoms were worse for stress and with high caffeine intake. And she has a history of recurrent urinary tract infections and subsequent antibiotic use for those infections. Occasionally, she has some mucus present in the stool and in the urine, but on her urine test, it was positive for white blood cells, but negative for bacteria or blood. And she also has a past medical history of IBS-C, so kind of sluggish digestion. She had some mucus in the stools. So you can see this kind of abdominal and pelvic inflammatory state. And we'll be walking through, she has all these different systems and contributing factors, how we could take a herbal approach to a case like this. So obviously, we want to help support the resolution of that inflammatory response. And to do that, we need to remove inflammatory triggers and irritants. Herbs, we can't just, keep drinking coffee and being stressed and not acknowledging those things and expect herbs to do everything. We have to, of course, address the lifestyle components as well. So promoting adaptation to stress and supporting her immune system overall is going to be really important. We also want to promote the actual repair, regeneration, and protection of those mucous membranes, especially, of course, the urinary tract, but also in the gastrointestinal lining, because the mucous membrane linings of the abdominal organs they're all connected to a certain degree, and we have some great herbs to do that. And key in supporting the resolution of inflammation is supporting the removal of metabolic waste and products as well. And we do that through the bowels and through the kidneys and the bladder. So we'll look at some various ways we can do that. So when you approach with a case like this, again, you're going to just kind of start brainstorming some various herbs: turmeric, willow, blueberry or bilberry, ginger, chamomile, boswellia, licorice. We have that big list that we just looked at. But how are we going to choose between them? And which ones are going to be the best choice for her? So in this case, who is our patient? Obviously, we need to be taking that individualized approach. What is she going to be willing to do? What should we be prioritizing for her? And then we really need to take a systems-based approach. So again, we're not just chasing symptoms. We're looking at what body systems need the most support for her. Besides just an anti-inflammatory herb, what other kinds of herbal actions are going to be indicated in a case like this? So, for example, if I'm trying to remove metabolic waste through the bladder, I'm going to maybe be looking at diuretics as well. And are there herbs that I know to be very anti-inflammatory and also diuretic? So that would be an example of like a secondary action. Are there key constituents that I know that will be that benefit to her? And what do I know about their pharmacology? So I could think about curcumin. I could think about, the flavonoids found in St. John's wort, perhaps, or the saponins found in licorice. What do I know about how they work, and could they be of most used here? Are there traditional uses? Is there anything that I've read of in the literature or in I should say, kind of more of that folk-based approach that aligns with herbs specifically for a condition like interstitial cystitis? Or again, has there been any clinical trials done that I can draw from? And again, safety concerns. Any of the herbs that maybe I'm brainstorming, are there ones that have a little bit of a safer profile or are less likely to cause a toxicity reaction or have an interaction? Is she on medications, that sort of thing? So always just thinking safety. What is her general health status like? This will also be important when I'm choosing certain herbs, maybe that have a little bit of a narrow therapeutic window. I want to make sure her liver and her kidneys are functioning well. Is she able to remove waste through the bowels? What's her microbiome like? So remembering that many of our herbs really require that fermentation by gut flora in order to become in their most bioavailable state or bioactive state. So always be thinking about a patient's gut flora. And compliance, as I mentioned, how invested or engaged is she going to be in her health goals? And whatever I give her, can I feel confident that those herbs are going to be active within the body and absorbed to where they need to be? Taking a systems-based approach, so this is just an example. This is not complete by any means, but I wanted to show, if you're some examples of approaching various body systems and herbs that might be specific to those systems. And so looking at this list, I hope that you're looking at the list on the column on the left hand, and there might be a few key systems or body tissues that jump out to you as being of primary importance for her. And then looking at what are some herbal examples that would be specific to treating pathology or imbalance within those systems. So we'll go through what I think maybe would be some good systems to approach here. Given that it is her urinary system that is the primary area where the inflammation is localized, I'm going to be looking at the bladder, absolutely, but I'm also looking at her gut, knowing her history, knowing that she's been on multiple rounds of antibiotics and that she has this history of IBS. I'm thinking about the mucous membrane linings within both her urinary and her gastrointestinal system, and what herbs can I use to help heal those mucous membranes and connective tissues. Obviously, her immune system, perhaps there's an autoimmune component going along here, but she's got this history of frequent urinary tract infections, so how capable is her body to fight infection? And understanding that immune activity is very much dependent on what's happening within the nervous system and the endocrine system, specifically within our sympathomimetic responses to stress and the HPA axis. So these are some of the main areas that I would be looking at. Yours might slightly differ, but immune, nervous, endocrine, GI, and urinary are kind of the key systems that I would be approaching in a case like this. Then when I know the systems that I'm after, I'm going to choose what actions are going to be most indicated. And actions, we'll go into some examples, can sometimes be divided in your mind between having either more of like a long-term normalizing or tonic effect, or being more specific in their biochemical impacts. And we would call these sometimes effectors. So I think it's very useful when we think about herbs. Are we using the herb as a normalizer or a tonic? Just kind of like a long-term approach, almost like you would when you're eating a food throughout your diet consistently in order to get the benefits. Or is it an effector that you're taking for a specific direct action? And an example of this might be a normalized, and one herb can be both. So I'll use garlic as an example. You might eat and enjoy garlic on a daily basis and understand the long-term benefits of consuming garlic, which can be on heart health. It can have carminative effects. But if you had a cold or flu, you could also take garlic and take it in large amounts, smash 3 cloves fresh and mix it in some honey or in some water and drink it down. And that would be using garlic as an effector to help really kill the viral infection or bacterial infection that you might have. So, but again, depending on the stage of inflammation and what your goal is for that patient, thinking about how am I going to employ this herbal medicine? Is it more of a long-term tonic like a food, or is it a specific action where I need to take it in actually quite a higher dose and maybe over a shorter amount of time? And so, like I said, same herb can be both. It's often dose dependent. If we're taking that kind of long-term approach, which is really what we're often doing in herbal medicine, where our goal is to kind of promote elimination and restore damaged organs and systems and kind of nourish the body, versus having that effector or more pharmacological-like approach, that, we're maybe trying to suppress a symptom or suppress an infection, something like that, which we can do with herbs. But it's not really, I would say, where herbs shine, and especially with inflammation. This is where drugs can really shine with suppressing pain and acute inflammation. But herbs are really, we want to be thinking more of them as tonics and long-term physiological support. So what I've done on this slide is we've still got all of those systems in place that I highlighted. All of the herbs that I'm going to be thinking about in this case are going to be anti-inflammatories, but those secondary actions are highlighted here. And of those secondary actions, what I've done with the column on the right is shown you which ones I might be wanting to use as effectors and which ones I might be wanting to use as tonics. So why that's important is because if she's in pain, I do want to address her pain, and I can do that in the short term with some herbs like the analgesics, with the demulcents, and with some, maybe higher potency anti-inflammatories and diuretics. But I don't just want to do that. I also want to be thinking what my long-term strategy is going to look like. And to do that, I want to still help resolve inflammation, but I want to rebuild connective tissues with connective tissue tonics and support those mucous membranes. I want to use adaptogens, nervous system tonics, immune system tonics, and lymphatics, all kind of working on, again, the endocrine, immune, and nervous systems as a long-term approach, because I know that stress is a big part of this patient's symptom picture. And so what I've done here is pulled out those key actions: adaptogens, diuretics, lymphatics, analgesics, connective tissue tonics, demulcents, immune tonics, nervine tonics, and relaxants. And this might seem like a lot at this point, but I hope that if you're getting started in herbal medicine, taking the time to go through these processes is what really helps you become much quicker later on in herbal practice. So brainstorming as many actions as you can, and then giving herbal examples for those actions. So you can see I've just kind of brainstormed, and if you can't brainstorm them, there's some good resources you can find on my website as well to get kind of lists of herbal examples for some of these key actions. And then once you have all of those herbal examples, you can kind of tease through them and decide which might be the best for her. And we'll look at some overlapping secondary actions that these herbs can have. And remembering that all of these herbs are considered anti-inflammatories, because really almost any herb will have compounds within it that have inflammatory modulating properties. So just a few herbs I want to highlight today. We're going to talk about, I've got some pictures of some dried herbs here. I always think it's nice to actually see what the herb looks like in its raw form. If we're just seeing it in a bottle or in a capsule, it's not quite the same. So what I have pictured up top here is a great connective tissue tonic. This is Gotu Kola. Below, this is an amazing adaptogen, Ashwagandha root. Another great adaptogen and immunomodulator is reishi mushroom. This is hops pictured here. Most people are probably familiar with hops as a alcoholic beverage, but in its really raw form, it's an incredible analgesic, nervous system relaxant, and diuretic. And excuse me, I've confused my herbs here. This is ashwagandha up in the right, the top corner. And the first herb here, this other root, that's actually marshmallow. So that's a really soothing, demulcent herb. So you can see we have some connective tissue building, some stress management, some analgesic activity, some immunomodulation, and some really soothing, demulcent, wound healing properties present in these 5 herbs that might be a great choice in her case, and they're all powerful anti-inflammatories as well. So what I love about Centella or Gotu Kola is it does have this ability to help rebuild damaged connective tissues while also managing stress and supporting nervous system activity. It is also a gentle diuretic, and so I can feel confident that I'm getting a nice removal of metabolic waste through the bladder. I'm also getting this kind of wound healing property as the plant compounds kind of move through the whole urinary system, which is a really important part of a long-term strategy to healing interstitial cystitis. Ashwagandha, so very calming adaptogen, great for people under chronic stress. It's also recognized for powerful anti-inflammatory activity. It's a collection of saponins in it called the withanolides that also are known to support the immune system. And we see that often overlapping effects of herbs that help us manage stress will also help support immune activity. And this is a slide that I think is useful. This was taken from a paper on chronic inflammatory disease and how it relates to stress levels. And what you see here are the three different kind of phases of the inflammatory response. So we have that initiation phase. This is when acute inflammatory processes are just on high, and then we have our resolution phase, and then the termination of inflammation. And you can see that depending on cortisol activity in the body, that will greatly dictate the resolution phase, when that starts and when that ends. So that kind of middle resolution phase is when we really want to be using herbs like turmeric and ashwagandha, these kind of anti-inflammatory, adaptogenic, immune modulating herbs. That's really their time to shine. And this, as I said earlier, is where we see most of our clients kind of come into office, as opposed to just in that acute phase, where we don't necessarily want to suppress the inflammatory response, because if we do, we can't actually end the initiation phase and enter into the resolution phase. So just the importance of cortisol, stress management, and inflammation, these go absolutely hand in hand. And we see that amazing ability of plants to often act on both systems at the same time. Cleavers, I mentioned earlier, or gallium apparine, is one of my favorite diuretics. It's also referred to often as an alterative, if you're not familiar with that term. That's used to be what would be called in folk herbal medicine like a blood cleanser or purifier, and it's kind of old terminology we don't like to use anymore, but essentially it helps remove metabolic wastes from the system, and Cleavers is very good at doing this through the bladder. It's also known to be a lymphatic, so it can help with lymphatic drainage. So again, just a great way to help remove waste. And I want to just give a little shout out to the lymphatic system, which gets overlooked a lot and is incredibly important in the resolution of inflammation. If we think about, obviously it's important in resolving infection and immune system overactivity, but for inflammation and edema and swelling of any kind, it's really important. And so we have other ways that we can support lymphatic drainage, but this is one of my favorite herbs for doing that internally. Kava kava, or Piper methysticum, this is just another herb I wanted to highlight because it's a really, really wonderful nervous system relaxant and analgesic. So if I'm dealing with a stressed out, anxious person with an inflammatory condition that also has a pain component, this might be a good choice as well. There are some safety concerns you want to be aware of kava, and dosing can really depend on the individual, but very, very powerful medicine. Hops is another great analgesic, as I mentioned, a nervous system relaxant. So again, wonderful for stress with a pain component, and also has diuretic and anti-inflammatory activities. And then marshmallow, or Althea officinalis, which root and leaf can be used for medicine, is incredibly rich in mucilage, which is a very soothing plant constituent. And we call it demulcent effects. Demulcent effects being very wound healing and soothing internally. So anytime there's kind of spasm, irritation along a mucous membrane, especially within the bladder, because there's diuretic effects of this herb as well, it can be a really great choice. And we have beautiful Ganoderma lucidum, or reishi mushroom, that bright red top coat to this amazing mushroom that has a very long and important use in traditional Chinese medicine. It does a lot more than just what I've listed here, but thinking of it as an adaptogen, it kind of overall helps the body adapt to stressors and respond more effectively to stress, which also then allows the immune system to respond more readily. And there is lots of good research around polysaccharides, beta-D-glucans, and reishi that have this ability to upregulate our immune surveillance significantly, and it's quite powerful medicine. Just another slide on safety. I think I'm really driving that home, that, as I'm talking about all of these herbs and all the wonderful things they do, just really make sure you're doing your due diligence in your practice to ensure that you're aware of any potential signs of toxicity, adverse reactions. Many contraindications around herbs are relative or theoretical as opposed to absolute. but there are a few exceptions to that, of course, and same with interactions. So just make sure you're doing proper monitoring with your patients or clients. And what I would say is the most common mistake that people encounter when it comes to recommending herbs is they miss the therapeutic dose. So when people come in and they say, oh, I tried this for that and I didn't really notice anything, one of the first things I'll ask is, okay, how much of it were you taking and how long did you take it for? Because the therapeutic dosing range for plant medicines are usually longer than people expect. So again, coming down to knowing your patient, what are they going to be willing to do? Can they commit to this sort of long-term approach? It's sort of like dietary counseling in a sense. And what is your intention? So are you looking for more of that effector-like approach or tonic-like approach? And that might dictate the amount of herb that you'll give. But you can, of course, look up specific dosing protocols as well. And understanding that there's a difference between dosing pharmacologically and dosing more physiologically, which is that kind of long-term nourishment approach. Knowing your dosing ranges, so finding a good resource, and I think some people struggle with, well, I don't know how much to give. As long as you're not giving more or less outside of a therapeutic dosing range, and most herbs have a very wide range, you're probably you're less likely, of course, to experience any toxic effects or to get no effect whatsoever. So aim for those ranges, but again, acknowledge who your patient is, what your intention is, and maybe you can slide up or down that therapeutic dosing range depending on the individual case. And adjust your dosing for acute versus preventative treatments, and especially when it comes to inflammation. And this is a quote from one of my herbal mentors, was big disease takes big medicine. And so, just throwing a little bit of turmeric into your salad dressing, for example, one night, it's probably not going to have the effect on your osteoarthritis that you're hoping for if you're just, doing that once a week or something like that. You really do need to usually reach higher therapeutic levels if you're trying to deal with more acute symptoms, especially pain, and that more long-term approach. So please put turmeric in your salad dressing every day for that physiological type of nourishment to the body. But just ensuring, again, people's expectations kind of meet what the herbs are doing, and remembering that the herbs aren't drugs. And just a little bit more information here on pharmacological prescribing, and it has its advantages and its disadvantages, but generally you doing more physiological prescribing in herbal medicine. So trying to address the underlying dysfunction of the body, supporting the resolution versus suppression of symptoms, and but the disadvantages, sometimes this can take a little bit longer for people, but it really is the best way to get the best results from our herbs and to see full resolution of inflammation. So this last slide here, I hope it's not too busy, but I've tried to incorporate that systems approach to the actions that we've chosen, again, showing which actions are going to be desirable at those higher doses short term, and which are going to be beneficial at the lower doses, sort of moderate doses, more longer term. And again, I hope that that most of this was kind of explained thus far, and it makes sense maybe, what herbs would fit into these action groupings, and thinking about how you might give and dose them. And what I've given is actually on this final slide, an example of what a formulation might look like based on this sort of systems-based and dosing strategy. So, for example, as an effector, so to deal with the pain and the inflammation that this patient was initially presenting with, I wanted to go quite high on my dose of turmeric, as well as consider using analgesic herbs such as kava and/or Boswellia, again, powerful anti-inflammatory, at the higher end of their dosing ranges in more of a short-term window to help deal with those symptoms. At the same time, incorporating a herbal tea that contained marshmallow and cleavers. So a demulcent, kind of soothing, diuretic blend that would be consumed, steeped very long for overnight, that would be consumed at least once or twice a day, a cup once or twice a day. So just helping with the removal of waste and kind of controlling the pain and inflammation as much as possible, as acutely as possible, but also acknowledging this kind of long-term approach, which is really important for her, which is healing those connective tissues, supporting the immune and lymphatic system, and her adrenal system as well. So looking at herbs like Gotu Kola, cleavers, ashwagandha, and hops, and I've given just a rough liquid extract formulation here and kind of quantities that I might use. And you'll see, 5 mils or a teaspoon twice a day for 3 months. So 3 months is a commitment for a lot of people. So just kind of keeping that in mind, that that type of a strategy, I might tell her that this would be the minimum amount of time that she would need to maintain this type of treatment in order to ensure that we don't see this recurrence happening over time. And liquid formulations I love, but not everybody will take. So tablets are also a nice option here. And I might look at using some immune modulators like Ganoderma or reishi, shiitake, so some medicinal mushrooms, or ashwagandha, which again, fabulous adaptogen and immune modulator, anti-inflammatory, but again, that long-term approach. And you'll depend on your patient. You might need to adapt and, check in regularly and switch your protocol as you go. But this type of thinking, I hope, is useful to you when you think about employing herbs, and just getting to know a handful of herbs well and using them in this way, I think will greatly improve clinical outcomes. So in summary, herbs are much more than being anti-inflammatories, and the resolution of inflammation requires this system or multifactorial type treatment approach. And we want to acknowledge that employing some of these traditional approaches to herbal medicine can often improve our clinical outcomes as well. So using the whole plant, maybe considering things such as energetics and tissue specificity. We want to look at our body systems and not treat individual symptoms, of course. And of course, know your patient and appropriate dosing strategy for that patient. Make sure that we're treating for our intended purpose and we're treating safely. Thank you so much for joining me on this webinar today. I hope that it was helpful. It maybe instilled a little bit more confidence to you in your ability to, if not necessarily prescribe herbs in office, at least be able to think about how you might in the future and access some of the information. Keep some good resources around you to just further with every patient, kind of further your herbal knowledge and become more and more proficient over time. Thank you so much.
Thank you, Dr. Marciano. Unfortunately, our time is up. This has been an enlightening evening, and we invite our audience to learn more about your work at thenaturopathicherbalist.com. Good night and best of health to you all.